Okay, welcome to our next case. This patient presents with both disc pain and facet joint pain, AP. He's from Texas. He's here with his lovely wife, and he's suffered with back pain for how long?
25 years.
Thank you, good job. 25 years of back pain. And unfortunately, no one in Texas was able to help him until he found our videos on YouTube and saw that we were able to help people out of pain and decided to come here. Right? All right. You ready? Is he ready? Has he got the mask on? All right. We're going to ask you a few questions in a minute, okay? Now, the surgery is called the Deuk laser disc repair. It's not really a new surgery because we've been doing it 17 years, but it's new for most people because they've never seen it. Now, we know from his back pain, when I asked him, where is your back pain? He told me it's in here. He pointed to this area. So I'm looking at his MRI thinking, what do we got here? We got two discs that are damaged. L3-4, L4-5. 25 years of back pain. Then when I was examining him, I was mashing on his facet joints. Those are the little joints to the back side. And guess what? These were tender on the left side. Really tender. So we know he has facet pain. Are you comfy?
How are you doing, my friend? You all right?
How bad is that on a scale of 1 to 10?
Give us a number. Give us a number.
How high?
10.
10. Is that where you get back pain typically? 10 over 10, ladies, concordant, 3-4. All right, sorry about that. Good news is we found one of your painful discs, the L3-4. That's the one I thought was hurting you. Is it better now?
Is it better? Is it better now, my friend?
How bad is that on a scale of 1 to 10? How high?
What'd you say?
How high does it go? 12. Is that where you get pain? It is. All right. Good news. You get to go to sleep now. We'll stop torturing you. So we got a 10 out of 10 and a 12 out of 10, 3, 4, 4, 5. Concordant, both of them. Yep. Take your time. All right, Jordan, let's show the audience on the discogram at 4-5. Show them the tear. You can see it right there. That's the tear, folks, the annular tear we always talk about. Okay? And Sanjay, do me a favor and show the audience the educational video.
Copy that.
How does an annular tear cause so much back pain?
Copy that. Playing educational video in 3,
Num num.
2, 1.
It's been one of those days. Okay, so you can see from our video that the annular tear gets inflamed and it becomes a source of pain and suffering. And it's very common to have tears that get herniated, and the herniations then trigger inflammation. That's what this patient has. He has painful annular tears. It's not the disc that hurts. Can we have irrigation?
Irrigation, please.
It's not the disc that hurts, it's the annular tear in the back of the disc. All right, interesting. So we need to go in a little bit deeper. Laser. We're just within the annular tear right now. Any questions, Sanjay?
No questions?
No, it's perfect. Thanks. Good job. I like that. I like when my team is paying attention, participating. Great job. I feel like we may have to go a little deeper. Not on the anesthesia, but on the tube. Not you, not you. We're talking to my team. Grabber. We may have to put the tube a little deeper. He is a big guy. I just want to take a look here. See what I can do. See, that's inside the disc right there. Piece of herniation. Oscar, please. Come on, man. We give you the chair job, but you gotta still do it. All right, this is 4-5, correct, Jordan? Correct. This is the one that had the tear that was kind of rising up, very thin. Remember that? On the discogram, very thin, very skinny little tear, right, that we could see. The reason why the tear is skinny is that's where the dye is leaking out. And in a lot of patients, their tears never fully heal. So they still have a tear, and there's still dye leaking out. And that's what we're dealing with this one. This is all scar tissue. You see that? The white stuff, scar tissue. This poor man has been suffering with his back pain for 25 years. Among everything else life has thrown his way. You know, he's got a lot of challenges in his life. And he's been suffering for 25 years with this back pain. And I don't know why nobody's ever helped him. Any idea, Dr. B? They're probably afraid of him, you know? He's a little different, and that doesn't make him untreatable. You know, I guess if you really understand what's causing pain, can we put the IV pull down again? It just always seems to be right in my way.
Good.
It's perfect, thank you. If you understand what causes pain in the back, then you can fix people, and you don't get distracted by things that are distractions. Okay? Every patient out there deserves to be out of pain. There's not a human being that should have to suffer with chronic back pain from a disc. It's very distracting. I don't know how people could live like this with chronic back pain. And you know, you try to live sober. I've been watching on Netflix the shows called Painkiller and The Pharmacist. Has anybody seen these besides me? Well, if you get time. Really good series. They're all about the opioid epidemic and how it started back in the 80s, 90s. It all really kind of began, first of all, there's been more than one opioid epidemic. There was an opioid epidemic caused by Bayer, the pharmaceutical company, many years ago, back in the 1920s, 1900s. And they were selling heroin in a jar for babies, for kids, to help them sleep at night. That was before they figured out how bad it was. And of course that went away, right? And then they began selling, the second opioid crisis happened when the war, veterans from the war, Vietnam War, came back. And they were all doing, a lot of them were doing opium, heroin, overseas. They were, I guess, not sure how you do opium poppies, but I don't know I think you cut the poppy with a knife and there's some resin that comes out and you harvest that and then you smoke it or whatever you do. I'm not really sure, but a lot of the soldiers from Vietnam came back and they were addicted to drugs. They were addicted to opium, heroin. So we had that crisis. Apparently, when they came back, they were withdrawing because they couldn't get it anymore. And they went through heroin and opium withdrawal. Irrigation's good? Okay. So we had those two opium crises, or heroin opium crises, opiate crises, and then more recently in the year 1989, 88, 89, 2000, this pharmaceutical industry, they started producing painkillers that were narcotic painkillers. And some of the doctors who were prescribing them were not really doing a very good job of prescribing them properly. And they were just giving out massive amounts to patients. And the patients were getting addicted, of course, and then they started crushing the pills and snorting or injecting them, I think, or snorting them. Maybe snorting them and injecting them. But point is, they were becoming abused. And it became a huge problem back in the late 80s, early 90s. And we had all these addicts then that were coming on the street addicted to opiates because they were prescribed by doctors. The OxyContin, oxycodone, oxy whatevers. And these poor people were lives were being destroyed. And that's what this series is about. Now, the opiates have been a problem for many years. And well, what's been happening has been wrong. People should not have chronic pain in their back, neck, knees, hips, shoulders treated with pills. Pills don't work. They just get addicted. My God, there's a lot of scar tissue here. Honestly, this is a lot of scar tissue. This white stuff is all scar tissue I've been working on. This is where the pain fibers, the nerve fibers are. At first I thought we weren't deep enough, but now I realize we are deep enough. It's not annulus I'm looking at, it's scar. Organized scar tissue. All right, so these doctors in the 80s and 90s were really encouraged strongly by the pharmaceutical companies manufacturing opioids to treat pain. Pain became the sixth vital sign? What is it? The fifth, sixth? I can't keep track. Sixth? Pain became the sixth vital sign. And we were all asking patients, are you in pain? And the reason that became a vital sign is because it was treatable, right? I mean, if your blood pressure's high, you treat it. If your heart rate's too high, you treat it. If your respirations are too low or too high, you treat it. So temperature, same thing. Your temperature's too high, you treat it. So pain became the sixth vital sign, fifth vital sign, I can't. I'm just a dumb neurosurgeon. Anyway, pain became another vital sign that we had to treat. And nurses were asking patients about their pain, which they should. And doctors were starting to treat pain aggressively with pills, which they shouldn't. What we should be doing is fixing the source of pain, which we now can. That's why the pills are no longer necessary. They're no longer necessary because we can now cure pain with the right surgery treatment. And that's the DLDR and the DPR. That's what this patient's here for. Any questions?
No questions?
Just about done in just 10 seconds. This is our first of 2 discs we're fixing. Again, the dye didn't really bind to anything because there's no herniation left. It's all scar tissue from years and years of inflammation and pain. This man's disc is now gone. His nucleus pulposus is gone. It's amazing the amount of pain he must have suffered through all those years. To have no more inflammation, no more herniation left. No more nucleus left. It's all pretty much just gone. It's one of the worst I've ever seen. All this is scar tissue. All of it. Okay, and you can see the nerve is up there in the fat. Can't even see the nerve, we're below it. And that's where the tear, annular tear and herniation were. I've debrided it. It's about 4 millimeters wide at this point. So it's going to heal beautifully now that I've gotten rid of the herniation part. We're going to do a little cleansing with some betadine and now irrigation. Come on, Jordan. Any questions?
No questions?
All right, go ahead and play the video on how the Deuk laser disc repair works.
Copy that. Playing educational video in 3,
No,
2,
I don't need it more.
1.
The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
All right, welcome back. Now you've seen how the Deuk laser disc repair works. It uses the endoscope through a tubular retractor and the laser to really clean out the tear. That annular debridement is the key. If you can do an annular debridement, you can eliminate patients' back pain. And that's what we do. So we're going to fix this disc at L3-4, and then we're going to perform the Deuk plasma rhizotomy to treat facet pain. Thanks, Luis, I got it. You're doing great. Lay still. Oh. All right, here we are at L3-4. We're inside the annular tear. You can actually see some faintly stained nuclear material. Oscar, do I have to give you a wakey pill? A pill to wake you up. Do we need to get some coffee in here? Get it going in your veins? A little coffee drip. You're doing sterilizing, right? You are.
Yes.
And Jordan.
Yes. Mainly me.
And all the cleaning? Huh? Cleaning of the instruments.
No.
Who's doing that?
You.
Yeah. But what about Jordan?
Jordan, I mean.
Too busy with
Yeah,
fluoro?
of course.
So basically, that's why we're hiring another fluorotech. Did you meet the fluorotech, Jordan? The one we're looking at hiring? I think Monica likes her. Oh, good. All right. I heard that Optum just closed down all their emergency urgent care clinics, Optum Health, which is United Healthcare. You know how United Healthcare Group is buying up all of these hospital systems and urgent care centers? Basically, the insurance company is buying up the hospitals. What do you think is going to happen to your care at that point? Huh? It's terrible. If they're paying for your care and you have some medical problem, what do you think they're going to say? You don't need treatment. We don't want to pay. We don't need treatment, which is what they do already. But when they own the doctors and the hospitals, it's easier to do, right? Yeah, it's a problem. I don't understand how they get away with it. It seems to be a monopoly to me. How does an insurance company get away with that? There's a lot of bad things happening out there in healthcare. Deuk Spine Institute is not one of them.
Spaceman for you.
All right, you can see this disc is badly damaged. A lot of scar tissue, but not as bad as the last one. The last one was worse. See how there's some blue here? The blue is nucleus pulposus. And nucleus pulposus is actually biochemically what it is it's molecules that are called proteoglycans and glycosaminoglycans, GAGs and PGs in biochemistry. And these molecules are really right, amino sugars, and their purpose is to bind water and hold water into the disc.
So they're hydrophilic.
Hydrophilic. They love water. Hydro is water, philic is lover, lover of water. If you're a chemist, you know what that is. Hydrophilic versus hydrophobic. Hydrophobic things are oils, fats, hydrocarbons. Don't like water. Yeah, phobia is fear, philia is love, hydrophilia is the love of water, hydrophobia is the fear of water. They're biochemical terms, and the nucleus is hydrophilic. It loves water, but what happens is over time with the herniated disc and the degeneration, the nucleus becomes more desiccated or dried out, less hydrophilic. God damn this thing. And that all comes about because of the inflammation from the annular tear, what I've been saying for many years. That inflammation destroys the disc. So the sooner you get it fixed, the better. Don't let your disc be destroyed. Come get Deuk Laser Disc Repair. Unfortunately, when you don't have treatment, the inflammation just keeps smoldering on and destroys the disc. Any questions?
We have a comment from Canes25 on YouTube. Doc, people are terrified to go to the hospital nowadays. It should never have come to that. This is such a tragedy.
It is a tragedy, Haynes25. I agree. Haynes25's point is well made. The insurance companies are destroying medicine and healthcare, and we've just stood by and watched it happen. And now I just posted in our Facebook channel a article that just came out about 11 hospitals that are recently closed. They're all going bankrupt. Of course, they say there's different reasons for their bankruptcy, but they're all the same. The insurance company is at the heart of all of it. The insurance companies strangle hospitals financially and choke them out. And they get to pick and choose whichever hospital they want. Hospitals' margins are 1% to 2%. So all you got to do is reduce the payments or reduce the authorization for procedures to a hospital for a couple of months, and the hospital is going to go bankrupt. It's that simple. There's no cash. They have very little ability to borrow. You're going to see more and more bankruptcies of hospitals. Think about what that means for you when you have an emergency, when you're going to die from a bleed in your brain or hemorrhage, GI hemorrhage or something, some serious medical problem. Is it a little light? That means you're going to die before you make it to a hospital that's open. And when you get to a hospital that's open, they may not have any beds for you. They may be completely full. So just make more beds, right? Well, they can't afford it. That's the whole point. The insurance companies are keeping all the money, and they're not giving it to the doctors and hospitals. And without money, you can't build more beds. You can't build more hospitals. Hospitals are closing. Our population is exploding, and our hospitals are closing down. It's a real problem. I've been talking about this for years now, about 20 years. And people are just don't want to be bothered until they are going to die, and then they die, and the hospital says we did everything we could do, and we just accept that. People need to stop accepting that. It's not the truth. The insurance companies are making billions of dollars a year in profit. Hospitals are getting less and less money, and they're having to close. Okay? That money should not be going to the insurance companies. It shouldn't even be going to the EMR companies like Epic, electronic medical record companies. They're stealing billions of dollars out of our healthcare system that we don't have. I think our national debt is over 30 trillion, isn't it? Anybody know? We're in trouble. We're on coding. Our country is basically, our healthcare system is coding. And nobody's doing anything to fix it. The key is the insurance companies. They're so corrupt. They're stealing all this money as profits for themselves. I could keep telling people about it, but unless people do something about it, it's not going to get any better.
How much time do we have on this test?
2 minutes. Grab her. How's he doing? Any questions?
We have a comment from Kelly on YouTube.
Yes.
Just sent my CDs overnight yesterday. I can't wait to speak with you.
I'm-
2, 3, 3, 4, 4, 5, 4, 6, and 6, 7, sitting on each other, narrowing off the nerve. Also, I had L5-S1 fusion in 2020. I have tons of scar tissues.
Understood. All right, we're gonna take care of you. We'll give you a diagnosis. You'll learn what's wrong, and then if you want me, I'll fix it for you. Okay? That's how this patient found us. I'm leaking water all over me, my foot. I feel it soaking my shoe. Huh? It's not about a towel, it's about diversion control. Except this time it's diversion of irrigation. 1 minute. So, yes, I look forward to helping you in our telemed and giving you the answers you want. Still. Where is it diverting? Do you see it? 30 seconds. My shoe is literally soaking wet. See the white stuff there? That's the herniation that we're trying to get rid of. The yellow stuff at 12 o'clock is fat. Not really interested in that. More interested in cleaning this tear up. All right, 10 seconds. Great. All done.
Thank you.
Let's see if we can see the nerve is going to be up there in the fat. There's the hole, it's about 2 millimeters. Great job. We're going to clean out this area with a little betadine, little antiseptic, just to make sure there's never any infection. We've not had an infection. We've had one person with questionable, but out of 1,700 cases, that's pretty good, even if you have just one infection. Can't say the same for any other type of spine surgery. Spine surgery is notorious for getting infections. All right, at this point, we're going to switch over from fixing the 2 discs to fixing his facet joints. And fixing means we can't get rid of the arthritis, but what we can do is we can, Coker, kill the pain nerves that are causing all of his pain and suffering from the facet joint. Shot? All right, so let's just remember what we're doing. We're doing a left 3-4-4-5-5-1. All right, so there's five, there's 4, there's 3. All right, let's get started. Shot. Shot. So pretty darn close there, Jordan, huh? That's it right there. Shot, num num. That's the perfect spot right there. See where the tip is? Let's show them the tip, Sanjay, on the x-ray. Just don't
Yes,
move.
doctor. Currently
Right
showing
there.
that.
See the x-ray with the little white arrow? That's the
Yes.
perfect spot for the DPR. That's where the pain nerve lives. Shot. Jordan, oh, he's moving. Don't move. Shot. Great. You're doing great. Shot. We're almost done, my friend. Shot. Just relax. Everything's okay. All right, I'll just wait a minute. Let's put a little pressure. You're doing great. We're almost done. Hang in there. Sure. We're going to be done in 2 minutes, but I'll wait. Yep, no problem. Take your time. Shot. You're doing awesome. Just hang in there. Shot. We're almost done. Shot. That's perfect positioning. My gosh, Jordan, you ever see it better than that? That is the spot, huh?
Not since the last time anyway.
I couldn't hear you.
Not since
Oh,
the last time.
all right, right? Thank you. Lay still. You're doing great. Shot. Almost done. You're doing awesome. Hang in there, buddy. Just lay still. Shot. Shot. Pretty good, huh, George? Shot. Like us to do that. All right, last one. Shot. Shot. Oh, Lordy. Look at that. It was almost really good. Shot. I'm on the bone. Shot. Jordan, does it get any better than that? Huh? Shot. I mean, I feel the facet. I'm on the bone. It's really nice. All right.
We have a comment from Kelly on YouTube.
I'll come take it over there before you read it. I'm done. Everything went well for him. We were able to treat the facets and the discs. And I'm going to come answer your comment in just a moment. Give me a minute, okay? So let's go ahead and show the audience one of our patients who had the procedure done.
Copy that.
I'm going to call the blood loss 1 mil. Go ahead.
Playing testimonial in 3, 2, 1.
And good morning.
I'm Dr. Deuk Majin. I'm here with one of my patients and friends who I've known for years, and she has been suffering with back pain for, well, I'll let her tell you how long. And a week ago, she came and had the Deuk laser disc repair. She's here for a checkup, and I'll let her tell you how she's doing as well. So how long have you had your back pain for?
Started back in May last year, and I just couldn't get any relief from anyone. Finally, I asked you, and the rest is history. So this last week has been the best week of my life since May of 2022. So pain-free.
Excellent.
Yeah.
Now, I know it got bad last year, but did you have back pain on and off before that?
I did. I actually got thrown from a horse back in 2018 in Ireland, and that's what I think probably started it. I was having lower back pain, but never really did anything about it, just sort of lived with it.
Kind of modified your life, took
Yeah.
it easy, try to avoid things that aggravated the pain.
Exactly.
And now I know that you were suffering so badly before the surgery, and here you are with a smile on your face.
Oh yeah, definitely.
Well, I'm so happy you're out of pain. You had the Deuk laser disc repair. You could actually see, we use a laser to clean the tear in the back of the disc where the pain comes from. The problem is most doctors don't know that's where the pain comes from, so they have no idea how to fix it. My years of doing endoscopic surgery taught me that that's exactly where the pain comes from. So it's a small little spot in the back of the disc. You fix that, the back pain goes away.
And it worked.
It's amazing.
It's like I told your wife, you're a miracle worker.
Oh, thank you very much. Is there anything you want to say to your fans out there?
I just highly recommend, if you've had back pain in the past, don't live with it anymore. Call Dr. Deuk. He is the best.
Yeah, so many people's lives are just, quality of life is ruined by back pain.
It is, and not worth it. I'm ready to start traveling again, so.
Not too much too soon.
Not too soon, I know.
All right, very good, Jean. Great to see you.
Alrighty, thank you so much.
You're welcome.
I appreciate it.
Great to see you.
You too.
Good morning, I'm Dr. Deuk Majin at the Deuk Spine Institute here in Melbourne, Florida, with one of my patients who traveled from California. He's been suffering with his lower back pain for years and found us on the internet and decided to come here and have the endoscopic Deuk laser disc repair. We performed that 12 hours ago, and here you are, ready to go back to California, it looks like. How do you feel?
I feel great. It took a long time to get to you. Surgery was quick and painless. I don't remember a thing. Your staff was wonderful, but I am pain-free.
That's awesome. Yeah, and you're going to stay pain-free. We don't have you on any pain meds. We don't have you on narcotics, killing your pain. We didn't put any medicine in your back to stop your pain, so what you have is natural. And do you feel that pain anymore that you had before you came here?
No, the pain is completely gone. In fact, I quit taking my own pain pills 2 or 3 days before I got here. And I am on no pain pills at all, and I feel wonderful. When I woke up this morning, it was a different day. And I feel great.
And I feel wonderful for you for doing that. That's why we do what we do. We can cure pain, and we want everyone to know that, because nobody should have to live with pain every day. How does pain affect your life every day?
Pain is traumatic. The kind of back pain that I was suffering put me in bed. And for the last 3 months, I have been absolutely useless. Absolutely useless. And so I found you. It took me a few months to get here, and it was worth the trip.
It will be for the rest of your life.
Absolutely.
Worth the trip. Pain robs us of our dignity, doesn't it?
It does. It absolutely does.
And your parents are here, and they're very supportive. And that, to me, is so important, that you have people that understand what you're going through. I'm sure your parents have been a big support for you.
Oh, absolutely. Yeah, I was at work, a short story. I was at work last Wednesday dealing with this pain, and my back finally gave out to where I literally could not walk anymore. And I was 600 miles from home. And so I called my mother and father. They flew to San Diego and arranged the trip to get here. I called your place. I was scheduled for February 2nd, and I asked Richard on the phone if he could get me in sooner, because I was desperate. And you guys got me in a week or two sooner, got me in the 24th, which was yesterday. And so we made the arrangements, and I flew here, stayed in the hotel for a couple days, and was operated on yesterday. And yeah, it's well worth the trip. I apologize for getting emotional, but it's been a long trip to get here.
Well, we want you to get emotional. because it is an emotional thing. When you've been burdened with this pain for so long and then suddenly it's gone, and you realize that life can be lived without that pain, you know, and that you can actually have a life without the pain.
Yeah.
So what are you going to do now that you don't have the back pain anymore?
Well, I'm going to get my life back together. I've got a new job, and they've saved it for me. My boss is wonderful, and I'm going to go back to work tomorrow, actually, if you can believe that.
Yeah.
And I'm going to start riding my bicycle again and getting healthy again.
Well, your surgery went very well. I don't know if you've watched it yet, but we were able to get in with a tiny 7mm quarter-inch incision and fix both painful discs, and they were both very painful for you. And the pain was coming from a small tear that's located in the back of your disc where your herniation came out of. And that tear was just so inflamed, and we were able to clean out the herniation that was stuck in your tear and use the laser to debride it. And that's what the Deuk laser disc repair is. It's a debridement of the annular tear to eliminate back pain and leg symptoms. So we also have a cyst. We didn't treat your cyst. And do you think the cyst is causing any problems for you?
At this point, no. I don't think so, because all of my symptoms are gone. This morning when I woke up, I was a little nervous about getting out of bed. But that subsided quickly when I stood up and could stand up completely erect with no pain or bindage feeling in my back.
Yes, when I walked in and saw him this morning for the first time, the first thing your mother said was, "Look how straight he's standing." So they must have watched you suffer for a long time.
Oh yeah. Yeah, my mom's a great lady. I'm blessed to have her in my life. And then that's my stepfather, Jerry. He's a wonderful man. He and I are pilots. We fly together. We do a lot of things. And he's seen me go downhill. He knew something was wrong, you know.
How did you find out about us?
I've been seeing a chiropractor in Sacramento for 35 years. And 2 months ago, I started to really feel bad. And I would go to him. And after about a month of going to him, and going to my doctor for some pain management for these symptoms, I finally figured out that something else was wrong with me. And so I asked the chiropractor, what can we do, because what you're doing is not helping me. My doctor put me on pain meds, and they took some of the sharp pain away, but nothing was helping. And so, being kind of a mechanical engineer, I decided to look into how my back was put together. And I requested an MRI from my doctor and from my chiropractor. And so that took 3 weeks to schedule. That's a long story. And I finally got an MRI, and I looked at it myself and realized that I had a cyst of some sort and that I had some problems with my lower discs. And that's when my chiropractor told me about you. He said, get on the internet and do some research and then call these people. So I called your store. They gave me some information. I FedExed my package to you guys, and a week later you called me. And about a week or two later, I got here.
Wonderful.
So, yeah.
And here you are pain-free for the first time in many years.
Many years.
Congratulations.
Yeah. Thank you.
Is there anything you want to say to your fans out there?
There is. This is a miracle. In Sacramento, everybody that I know said, why are you going? Why are you going to Florida? Why don't you find somebody in Sacramento? And I said, well, because I was referred to Dr. Deuk and I've done a bunch of research on him, and I just have a great feeling about him. Not only that, he personally called me on the telephone because I told his people that I had some questions. And that's what sealed the deal. And so it took a while to get here, but it was worth everything. And I would recommend anybody send your MRI to this guy, and if he can help you, he will. Okay? Thank you, Doc.
You're welcome, sir. It's my pleasure.
Yeah, absolutely.
All right, go enjoy the rest of your
All
life.
right, thank you.
I'm Dr. Ari Deuk at the Deuk Spine Institute, here with a patient from Virginia who came out to the Deuk Spine Institute yesterday for surgery, and we fixed 2 discs in his lower back. You were having back pain for some time. Do you still have that same back pain?
No.
Gone.
I my back feels 100% this morning. I was able to sleep in the bed, laying flat for the first time in 2 months. I was sleeping on the couch for those 2 months. and I did not get good sleep at all. So I feel great in my back.
Good. Well, that's why we're here. We wanted to cure your back pain and give you quality of life back. What was life like living with that back pain?
Any day you'd be like, it could happen today. I could go down with back pain, severe back pain for a week. And that happened. My first pain started about 5 years ago. I was working in the flower garden. I went down with severe pain. I was down for probably a month that time. And ever since then, it was just like randomly, just out of the blue, I'd go down for another week with severe back pain. It was just no way to live because I knew every day waking up it could happen today.
Yeah, it is no way to live because then you got to be careful every day. You don't set it off. You're worried about it. You're thinking about it. It takes control of your whole life, that back pain. His back pain happened to be coming from 2 discs. And did you see any other doctors? Did they recommend treatment for you in Virginia?
Yes, I was seeing chiropractors for the first number of years. The first chiropractor, he put me on this decompression table, and he would, pull you apart. I did that for 6 weeks. I felt a little relief at first, but it didn't last very long. And I've been seeing just regular chiropractors throughout the years as well. And then when this happened, I saw an ortho doctor. He did not recommend surgery. He recommended physical therapy. He said surgery is like a coin toss. It either works or it doesn't. And that was not good enough for me. I needed a little bit more reassurance that it's gonna work. That's when I started looking for other options. And I had a lot of time on my hands. I did a lot of research and I found Dr. Deuk here. And I started watching his videos and testimonials, made up my mind right there. It was without a doubt, that was my choice right there. I submitted my MRIs and within 2 days I did my virtual consultation with you. And 10 days later I'm here.
Yeah.
And it's amazing. I had an appointment with an orthopedic doctor in Charlottesville, and that was February the 2nd for my first visit, just for a consultation. And who knows how long it would have gone after that.
Years.
And yes, I'm done now. It's just, I'm back to recovery.
Yeah, the problem is, unfortunately, the vast majority of doctors treating back pain don't know how to cure it. They just don't. And if I had to put a number on it, I'd say 99% do not know how to cure back pain. It really comes down to 2 things. You have to make the right diagnosis. Where is the pain coming from? Most doctors really don't even know it comes from the disc, and that's where it comes from about 90% of the time. Then the second problem is knowing how to treat it. And the treatment that works, the only treatment that works, is surgery on the herniation, really. And there's 2 surgeries that work, fusion and the Deuk laser disc repair. I've done fusions for years. I've cured people's back pain with spinal fusions, but that's a big, bloody, messy surgery with screws, rods, cages, long recovery. You're on opioid painkillers for months, like 3-6 months, just taking painkillers, just getting over the pain from the surgery. Not the back pain from the surgery. So when we started doing the laser surgery, people weren't having any back pain afterwards. They'd have just a little discomfort for one night. We realized they didn't even need the opioids anymore. So our laser patients don't get any painkillers except Tylenol and usually 1 or 2 Robaxin. So you did it. You happy you did it?
I'm very happy.
Yeah. And you can see in the surgery that we did, we actually got into your disc. We used the laser to clean up those tears at L4-5 and L5-S1. Surgery went really well for you. We didn't have any problems. It was just a tiny Band-Aid incision on your back, and that's why you went home an hour later, and that's why you're here today, ready to go home. Where are you guys heading back to Virginia?
This afternoon.
Driving?
No,
Flying?
we're flying.
Flying out of Orlando?
Orlando.
Awesome. Anything you want to say to your friends and family and people you know out there?
Yes, living in pain is hard. It's not a way to live. And I recommend Dr. Deuk any day.
Well, thank you. I appreciate that. You had faith, and you're going to be rewarded for that. Congratulations.
Thank you.
All right. Good to see you. And good morning. I'm I'm Dr. Deuk. I'm here with one of my patients and friends who I've known for years, and she has been suffering with back pain for, well, I'll let her tell you how long. And a week ago, she came and had the Deuk laser disc repair. She's here for a checkup, and I'll let her tell you how she's doing as well. So how long have you had your back pain for?
Started back in May last year, and I just couldn't get any relief from anyone. Finally, I asked you, and the rest is history. So this last week has been the best week of my life since May of 2022. So pain-free.
Excellent.
Yeah.
Now, I know it got bad last year, but did you have back pain on and off before that?
I did. I actually got thrown from a horse back in 2018 in Ireland, and that's what I think probably started it. I was having lower back pain, but never really did anything about it, just sort of lived with it.
Kind of modified your life, took
Yep.
it easy, try to avoid things that aggravated the pain.
Exactly.
And now I know that you were suffering so badly before the surgery, and here you are with a smile on your face.
Oh yeah,
Yeah.
definitely.
Well, I'm so happy you're out of pain. You had the Deuk laser disc repair. You could actually see, we use a laser to clean the tear in the back of the disc where the pain comes from. The problem is most doctors don't know that's where the pain comes from, so they have no idea how to fix it. My years of doing endoscopic surgery taught me that that's exactly where the pain comes from. So it's a small little spot in the back of the disc. You fix that, the back pain goes away.
And it worked.
It's amazing.
It's like I told your wife, you're a miracle worker.
Oh, thank you very much. Is there anything you want to say to your fans out there?
I just highly recommend if you've had back pain in the past, don't live with it anymore. Call Dr. Deuk. He is the best.
Yeah, so many people's lives are just, quality of life is ruined by back pain.
It is, and not worth it. I'm ready to start traveling again, so.
Not too much too soon.
Not too soon, I know.
All right, very good, Jean. Great to see you.
Alrighty, thank you so much.
You're welcome.
I appreciate it.
Great to see you.
You too.
And good morning, it's Cinco de Mayo here at Deuk Spine Institute. It's May 5th, 2023, and I'm sitting with one of my patients who traveled from Ohio because he's been suffering with back pain for many years, as well as pain down his leg. And I'm going to let him tell you about that in a moment, but first, how are you feeling today?
Feel excellent. My back pain's gone. Feel like a new man.
Awesome. And your leg?
Leg, I just have a little cramping yet from walking off out of Kelder for so long. I'm compensating for my back, so I've got to work through that a little bit. Yeah, we knew that would be, but the back is excellent.
Good. And how long did you have back pain for?
25 years ago, I did some stupid lifting and bulged discs out and then just lived with them. I didn't want to do conventional surgery, which I'm glad now that I was always waiting on a less invasive surgery. And when I got reading about the doc, that what he did and the procedure and all the success rate, just thought, I did a lot of praying about it actually.
You were offered other surgeries and you chose not to do them.
Yes.
That was
Yeah,
smart.
I was afraid of conventional surgery.
And what convinced you that the Deuk laser disc repair endoscopic surgery, which you can actually see right here in the video, is done with a small incision on your back, 7 millimeters or 8 millimeters. What convinced you that was the right treatment for you?
Well, because I didn't want to be tore up from, a big wide incision and all the cut muscle and scar tissue that probably was going to end up with. I've heard about, saw a lot of people in my business come in, hardware store, that had surgeries, and some were better for just a little bit and back into surgeries again, and just never ending. It seemed like once they started, it was never ending. So I was looking for something that was totally different and perfected.
Definitive.
Yes.
So you can move on with life.
Yep.
What's life look like for you now that we fixed your back?
It's good. I want to get back to normal activity, use my head, not abuse myself like I have over the years with working with masons and plumbing and water heaters and a bunch of massive lifting all my life. Just going to try to live a good retirement life and work light and keep on going.
A lot of surgeries that are done on the spine require patients to take powerful narcotic painkillers afterwards. Are you on narcotic painkillers?
No, nope. I took one Tylenol this morning because I'm going to be driving 3 hours, and that's all I've taken.
So basically the result of no pain in the back, it's not because we're covering it up with medicine or anything.
No.
Yeah.
No.
That's
I rolled
right.
over in bed at night and it was unbelievable. I laid awake for a couple hours just thinking about the amazement of it.
Praise God.
Yeah, for sure.
Well, is there anything else you want to share with your audience?
I just advise anybody that get an MRI and send it. It sounded goofy doing it online, but it sounded like it was too good to be true. But as you read about it and what he's done, it's the real deal.
Congratulations.
Yep.
You
Thank
had
you so
faith
much.
and it's paid off for you.
Yeah. Thank
Enjoy
you.
yourself.
Okay.
You have a lovely wife too who's been very supportive. I know she's been suffering along with you,
Oh,
right?
yeah.
As spouses often do, watching their spouse suffer every day with pain. And I know it's been hard on her.
Yeah.
And she's such a positive force in your
Yeah.
life, I can tell.
She is.
She's got a lot of good energy there.
Yeah. 44 years of it.
Well, you take care, sir.
Yep. Thank
Enjoy
you.
life.
Thank you so much.
You're welcome.
Yeah.
And we're done with this surgery, and I feel pretty good about it. This patient that we just completed had 2 of his discs repaired. Those were the L3-4 and L4-5. And when I got in there, I found that both discs had a lot of scar tissue from years and years of inflammation. I was able to get in and clean out, get the pressure off the nerve roots, and then, as you know, we did the DPR, Deuk plasma rhizotomy. We burned the pain nerves going to the facet joints. And that went really well. So I didn't have any complications or problems. The anesthesia was challenging this case. Our patient has bad sleep apnea. So, and he also is what we call opiate naive. That means that while the anesthesiologist is giving him medicine to put him to sleep, he went to sleep very easily, very suddenly, a little bit deeper than we wanted, and we had to wake him up, and but everything went well. Now, this patient is a patient who's had, lost both arms, and we were able to get the surgery done and hopefully improve the quality of his life. When I met him for the first time, he was on telemedicine with his wife. I believe he's from Texas, and he looked just miserable. He'd been suffering with back pain for many years, and it broke my heart to see him in that condition. So we got him here, and we got the surgery done today, and I'm hoping that that's everything he's going to need. But you never know. We talk about how there are 30 different causes of back pain. We've now fixed 5. So hopefully those 5 are his only 5 he's ever going to have. Unfortunately, people get arthritis throughout their spine, and we never know which joints that have arthritis are going to be painful until we do an examination. And we do an examination, and based on that examination in clinic or telemed, we determine which joints are painful and which joints need to be treated. And we did that for him, and I feel confident. I double checked him. I checked him on telemed. When he came here, I double checked him in the clinic, and he had the pain in those 3 facet joints and pain in the 2 discs. And I truly hope that that's all he has pain from. But we'll see. But he's recovering nicely. He's in the recovery room. He's already awake, talking. But the surgery went very well. All right, do you have any comments or questions?
Yes, we have a comment from Kelly. She says, "Thank you. I have been watching your surgeries for a few months now. Look forward to speaking with you."
Thank you, Kelly, and I look forward to speaking with you as well.
Next question's from James on YouTube. I don't quite understand the question. So he asks, does loss of height from fractures symptomatic of the pain traveling to the ribs and hips?
So, great question. Give me a second. This patient is asking, or this person is asking, if you have a fracture of the vertebral body, if it collapses down, can that cause pain to go into the ribs? The answer is yes, if you have a thoracic fracture. That means a fracture in the thoracic spine. And what happens when you get a fractured vertebral body is the bone can push backwards and pinch the nerve that's running around the ribs. So a fractured vertebral body can definitely cause rib pain by pinching a nerve, and that should be fixed surgically.
That's all the questions that we had.
That's all the questions. Wonderful. All right, thanks for joining us. We'll be back in 30 minutes with another surgery.